We're going to move to our last session now. It's Dr. Linda Carlson, and Dr. Carlson holds the Enbridge Research Chair in Psychosocial Oncology at the Cummings School of Medicine at the University of Calgary, and adjunct professor in the Department of Psychology. She's the director of research and works at she works as a clinical psychologist at the Tom Baker Cancer Center out there in Calgary. Dr. Carlson published a patient manual with Michael Specka, and it's called Mindfulness-Based Cancer Recovery. It's really very good, and it's a step-by-step approach to help you cope with treatment and reclaim your life. Maybe Mona, I could ask you to, or I can put it in the chat while you're watching her video. Dr. Carlson is going to be speaking to us through a pre-recorded presentation. Unfortunately, she was not able to join us today, but she is going to share excellent techniques and information on how people with cancer can benefit through the Mindfulness-Based Cancer Recovery Program. And I know that we have some of our regulars here, and they may have seen the video. Dr. Carlson did a full webinar with us, and it was really quite informative and great techniques. It was well received. So I'm now going to switch to the video with Dr. Linda Carlson. I hope you enjoy it, and then we'll see you at the after that. Thanks so much.
Hi there. Thank you for inviting me to speak today. I'm sorry I couldn't be there in person. Today, my talk is entitled How Mindfulness Can Benefit People with Cancer Through the Mindfulness-Based Cancer Recovery Program. So I'm going to begin just by briefly talking about the cancer experience. Integrative oncology is a broad field, something about the mix of 6 protective factors, and then focus on stress management through mindfulness and the Mindfulness-Based Cancer Recovery Program. So as you know, if you've worked with or experienced cancer personally, it's quite a shock, and there's many different emotions and feelings that people will have. So one central element to the experience is this feeling of loss of control. So you may have felt like your life was all planned out, you knew what was coming, but this throws everything up in the air. So people can feel very helpless. There's a life threat. No matter what the prognosis, it makes people think a little bit about their mortality, how they want to live their lives. There's a loss of predictability and routine in your days. Many emotions like grief, fear, anger, depression are prevalent. And symptoms of illness and treatment such as pain, fatigue, sleeplessness, chemo brain or brain fog. And of course, no matter what the prognosis, there's always a fear of recurrence or progression, and that tends to escalate around the time of follow-up tests. We sometimes call that scanxiety. And of course, caregivers are not immune from all sorts of different, well, similar actually, experiences. And so we like to think about their plight as well. All right, so before I get into mindfulness, I'm going to talk about integrative oncology. I am the president currently of the Society for Integrative Oncology. We're an international group. We define integrative oncology as a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and our lifestyle modifications alongside conventional treatments. So that's a key element of integrative oncology, is that all these therapies are provided in conjunction with conventional treatments, not as an alternative. And integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond treatment. So within integrative oncology, we study a number of different complementary therapies, and they can be grouped into these categories of lifestyle modifications. So that includes things like exercise, general physical activity, diet and nutrition, sleep hygiene, sleep management, and also stress management. And these are foundations of wellness that everyone should have in place, whether you're facing cancer or not. And there are specific mind-body therapies we often study and use. I'm going to talk more about mindfulness meditation, but also there's a strong evidence base for yoga, acupuncture, as well as things like Tai Chi and Qigong. And also there's natural health products that are part of integrative oncology, different vitamins, minerals, herbal therapies, botanicals as well. So I mentioned the mix of 6 protective factors, and I want to recommend this book called Anti-Cancer Living by my colleague Lorenzo Cohen and Allison Jeffries. And so the 6 protective factors that's covered in this book are diet, as I mentioned, physical activity, stress management, so those foundations of health, sleep, love and support, so social support being also very important, and then environmental toxins and how they can be eliminated from your home. So today, really, the topic is around stress management, and also we see some impact on sleep. So let's launch into the concept of mindfulness. What is it anyway? It's become very popular over the last couple of decades, but there's lots of misconceptions. So if you look at these covers of Time magazine, you might think that if you meditate and practice mindfulness, you'll become a serene, beautiful, young blonde woman. Sorry, that's not quite what it is. How we define it is paying attention on purpose in the present moment with an open and accepting attitude. So mindfulness is both a way of being in the world. You can be more or less mindful as you go through your days. It doesn't take extra time to do things mindfully or be mindful, but it's also a practice that we have to fit into our lives, mindfulness meditation, to train ourselves in the capacity to do that. So this illustrates the way of being. We've got the human with a cluttered mind and the dog who's just thinking about what's right in front of him. And so who wins the contest? Well, the dog is certainly more mindful than the human. So maybe we can learn from our pets in that respect. This illustrates the practice. So setting aside time to sit and cultivate the skill of paying attention in the present moment. So if we think about mindfulness, it's simple, but not easy because our minds are always jumping around from branch to branch. They're very busy. So if you think about what your mind's doing a lot of the time, it turns out we have anywhere from 50 to 70,000 different thoughts every day. A lot of thoughts going through our mind. When we've done studies to ask people during the day what they're thinking about, what they're doing, it turns out that about half the time people are not in the present moment. So their minds are wandering away from what they're doing. It also turns out that when people are focused on the present moment, they tend to be happier, no matter what they're doing, washing the dishes, grocery shopping. If you're paying attention to it, you tend to be happier. So why would that be? If you're not paying attention, if your mind's wandering, let's think about that. Where does it go? Well, often it goes to the past, maybe like this woman. So she's thinking, oh, if only I'd done or said this, or why me, or how did this happen? She's having regret. She's feeling sad and depressed. She might be angry, having these shoulda, coulda, woulda thoughts. Or maybe you're like this guy. His thoughts are racing off to the future. He's thinking, oh my God, I've got so much to do and I don't know what's going to happen. And what about this cancer? And he's feeling really anxious and stressed. So when your mind's not in the present moment, that's often where it goes. Ruminating about the past, feeling sad, or worrying about the future. But when we're able to pay attention just in the now and not worry so much about yesterday and tomorrow, often things are kind of okay. But our minds are not trained to do that necessarily. So let's look at how we break down the components of mindfulness. We talk about 3 components: intention, attention, and attitude. So your intention is why. Why would you want to practice mindfulness? Our simple definition said it was on purpose, but what's the purpose? This is kind of your motivation for practice. So for many people, it may be just to be more awake and aware in your life, to improve your relationships, to help you treat your cancer, even to just help you sleep better at night. The next part is the attention. This is sort of the core of what do you do in mindfulness training. We train ourselves through meditation in the capacity to keep our awareness in the present moment. We gain insight into how we cause ourselves suffering through that practice. But there's also the how. The attitude is really important. It needs to be open and accepting and kind. So let's unpack the attitudes a little bit more. It's important to notice the judging mind, especially around ourselves. Oh, I can't do this. I suck. I'm no good. And let go of some of that judgment. Be patient with ourselves, with the practice. It takes time. Accept where we're at. You know, nobody asked for a diagnosis of cancer. No one wants to be doing this, but here you are. You know, accept the wide range of feelings that you have. They're all normal and they're all healthy. Just not trying to change things. Just let them be, let them pass, letting go. Letting things come and go as they will, not striving for a specific outcome, just being in the moment, trusting yourself, trusting the process, and starting over, always starting over with what we call the beginner's mind. questioning some of the assumptions we might have. So if we think, well, that's a tall order, all these attitudes are kind of different from what society tells us, well, let's look at the opposite. So if you do the opposite of these things, you'll be judgmental, impatient, rejecting, grasping, striving, suspicious know-it-all. It's like a recipe for stress. And maybe that describes some people you know, or maybe even yourself a little bit. So it's time to consider perhaps letting some of that go. So what mindfulness is not, as I said, there's many misconceptions. It's not just relaxation. Although you may feel relaxed, that's not the objective. The objective is awareness. It's not a form of hypnosis. It's not a religious practice or a form of prayer, although it can be incorporated into any religious tradition. It's also not making your mind go blank or clearing your mind of all thoughts. It's an awareness of the thoughts as they come and go without clinging to them, without following them. It's not always peaceful and calm because sometimes we have all sorts of upheavals and difficult emotions, but we can be mindful of those as well. So why mindfulness? Well, the only certainty in life is change. And the unwillingness to acknowledge and act upon the reality of change is the root cause of all suffering. So mindfulness is one key process by which we face and accept the inevitability of change. And we like to use poetry in our program. So here's one from Thoreau called, it starts, I went to the woods because I wished to live deliberately, to front only the essential facts of life. See if I could not learn what it had to teach, and not, when I came to die, discover that I had not lived. So it's being awake and aware in your moments. Normally we do a little mindfulness practice now, but I've only got a 20-minute talk. So let's take a couple of breaths and then we'll move on. So maybe ground your feet on the floor, sit up straight, allow your eyes to close, take a deep breath in. As you exhale, allow your shoulders to drop. Let your belly soften. With each exhalation, just feel a washing away of tension. Just letting the breath come and go naturally. And notice the wandering mind. We call it a monkey mind, jumping from branch to branch sometimes. Just gently lead it back to noting the in and the out of the breath. Think rising and falling and softening with the exhalation. Let's open your eyes and move on. That just sort of small getting in touch with the breath is one of the practices we often do because the breath is always present. It's also very powerful in helping us to regulate our levels of tension and energy in the body. So I'm going to mention a program called Mindfulness-Based Stress Reduction, another book here that is wonderful by a fellow named John Kabat-Zinn, who developed this program back in the 70s in the United States. And this program has, it's standardly an 8-week program. It combines stress reduction and intensive training in mindfulness meditation. And since it's been developed about 40 years ago now, there have been hundreds of studies showing it's effective for a wide range of physical and psychological disorders and symptoms. I highly recommend the book, Full Catastrophe Living. And there's a website called AMRA, the American Mindfulness Research Association, that has research summaries if you're into that and wanting to see all the scientific research. I can just summarize it here for you. It's quite astounding, actually. So this goes up to last year. And what it's showing, there we go, is all the publications since 1980 that have mindfulness in the title in the scientific literature only. So this is not all Google, there's millions there, but in scientific journal articles. And so the year 2000 that I've circled here was the year we first published mindfulness applications for people with cancer. And you can see it's just skyrocketed. Since then, every year since, I don't know, about 2018, there's been more than 1,000 publications every year across all different kinds of disorders and conditions, psychological as well as medical. So let's talk about mindfulness for cancer patients. So I talked a little bit about the cancer experience, and that gets at the why for mindfulness. And we can see the spider here struggling with loss of control. He says, "My life's a mess, doc. You got to help me. I just seem to be spinning out of control." And I know many of our people with cancer can relate to that. So we talked about the illness experience already. The neat thing about mindfulness is that the approach through MBSR and its adaptations tackle all of these in different ways through training people in regulating emotions, recognizing and regulating those different emotions, and those attitudes I talked about: acceptance, letting go, non-attachment to outcome, and self-compassion is also a core feature of the program. And that can help with all these different elements of the illness experience. So our program is called Mindfulness-Based Cancer Recovery. It was developed back in 1996 by some of my colleagues based on their personal yoga meditation practice. And then I arrived at our center in 1997, just finishing my PhD, and I knew about Jon Kabat-Zinn and MBSR. I had been practicing for many years by that time, well, 5 or 6 years. And so we adapted the MBSR model for people with cancer specific to those aspects of the illness experience, and we started a program. It was open to anybody with cancer, any of their family members. We've been doing it in groups of 10 to 15 people, mostly in person. Since then, the last few years have been on Zoom, but over 3,000 people through the program. And we have done lots of studies to evaluate the effects of the program within that clinical setting. So our program started as 8 weeks, now it's 9. Our weekly meetings are around 2 hours. There's often 1 or 2 instructors. And the format is that there's a discussion around home practice, there's some teaching material, and then there's always practice of mindful movement, yoga, and different types of meditations as we go through the weeks. So we follow a booklet that outlines the program. There's a reading list. Daily practice is encouraged. We now have tracks online and different resources people can use. We started with CDs. They keep a homework log of time spent in meditation, and there's a silent retreat partway through the program. So over the years, we recognized that not everyone lives in Calgary or can come to our program. So we wrote this book, Mindfulness-Based Cancer Recovery, it's called. And it is a patient manual. It's a step-by-step approach. So it could be used as a home study program for anybody. It takes you through all the elements of the program. It has guided meditation scripts. So that came out in 2011, and it's been translated to a whole swack of different languages now, in Italian as well. I know you're viewing this in Italy. It is available in Italian, in Dutch, French, Spanish, also Chinese, and I think a few other languages as well. So we train people in a whole sort of buffet or smorgasbord of different meditation practices that they can go on to use. The body scan is all the people lying there on the right. Looks like they're napping, but they're actually learning how to do a sensory awareness body scan. The fellow sitting in a chair is doing sitting meditation. So you don't have to tie yourself up like a pretzel or sit in the lotus position to do this practice. You can be comfortable in your chair. We do some walking meditation. We practice open awareness meditation. We use imagery like mountains and lakes. That mountain there is right near my home in Banff, Canada. And we practice loving kindness meditation as well. Now, I mentioned that yoga is an essential part of it. We see this as mindful movement, as connecting with the body. The practices are very simple, but we do that part of the program every week too. So let me summarize now some of our research results. As I mentioned, we've been doing different studies since the late 1990s. Our first publication came out in 2000. You can find them all on my website. First, we started looking at symptoms that people were suffering from. So we looked at stress symptoms, mood, anger, anxiety, depression, and saw huge reductions in our first studies in people who took the program. Kind of encouraged us to keep going. And we started looking at symptoms like sleep problems, fatigue. Those also do improve over the course of the program. And then those kind of what we might call mechanisms that support or that are kind of behind the symptoms of stress and depression, like rumination, going over and over things from the past you can't change. It's sort of ruminating or worrying about the future. Those things also improve over the course of the program. We looked at the partners who participated. They also showed similar improvements. And then we looked at, okay, could we not only manage symptoms, but help people live better? And we saw improved quality of life. People said they had more of a sense of spirituality or connectedness, a sense of meaning and purpose, using the cancer experience as a catalyst for growth, and overall levels of mindfulness. We also take all sorts of samples of blood and saliva, and we look at what's happening in the body. We've monitored blood pressure over the course of the program and seen improvements in people who have borderline high blood pressure. We've seen improvements in stress hormones like cortisol. We see decreases in inflammation. We even see at the level of the DNA, there may be an effect on the telomeres, which are markers of cell aging. So there's no question that these practices also get into the body. But we've also been aware that there's barriers to coming to these programs in person, where people live, how much time it takes to drive there and to park, and the costs of childcare and taking time off work. And also the symptoms and side effects themselves make it hard sometimes to participate if you're too tired or experiencing pain. Many patients are immunosuppressed. They want to stay away from groups. And of course, since COVID-19, many people were forced to go online. We'd been doing it for many years before that. And so there are a number of what we would call digital health interventions, or ways that we can offer the program to people where they're at. So we did a study in 2012 on online mindfulness-based cancer recovery. And this is like real-time interactive video conferencing like Zoom. And that's still available through this company called emindful.com. We've done a couple of studies to evaluate it. It seems effective. We also created an app called the Mindfulness-Based Cancer Survivorship Journey. We partnered with an app development company. I have a link for downloading this at the end, so don't worry. So we work with a company that has an app called AMDTX. So AM is in I am, and DTX means digital therapeutics. And so we've done a pilot study with that, a small group, well, about 80 patients, to see if it could help. It seems to. And now we're doing a large Canada-wide trial with over 300 people using this app. Another thing you might find interesting is a study we're doing in virtual reality. That's the app. Virtual reality, we've created a virtual reality headset that's got a kind of nature images and guided meditations specifically to help people with chronic pain. That's not available commercially yet, but we are testing that out for people who are suffering from chronic pain. I know I have to wrap up. So in summary, mindfulness is present moment, non-judgmental awareness with elements of acceptance. It's a way of being in the world, which can be cultivated through meditation practice. And programs like MBSR and MBCR train people in mindfulness, and we know they can help decrease a range of symptoms like anxiety, stress, depression. And mindful awareness can help people cope with everyday stressors in the moment too. And I wanted to just finish with a number of resources. Hopefully the organizers can share this slide with you, or take a picture of it. And this just shows you some of our websites and where you can access the online and the app, and that sort of thing. So I want to thank everyone very much for listening, and I hope you enjoy the rest of your conference. Thank you.
Thank you. And I will convey our thanks to Linda. I find that an excellent, the whole concept and how it is helpful to patients. We had great results, as I mentioned, from our last webinar when Linda joined us live, and we had a lot of good information after that. Patients were really enjoying it. We do have some comments in the chat, which I will share. And Mona has also kindly put up the book in the chat. So if you're interested, you can certainly tap in and see. She's put in the link. Karen shared with us that this program is offered online via Wellspring in Alberta. Obviously, she thinks that it's great and it's free. The apps and online programs mentioned by Dr. Carlson are all quite good. And so just give me 1 second. Oh, apps and online programs are quite expensive, apparently, but it is offered free in Canada. I think that we can help too, that if you are interested in any of these programs or the books and you happen to miss it in the presentation, we will have the presentation online in a little bit. So you'll be able to check it out there, but please email us at info@kidneycancercanada.ca, and we will certainly share any information that you're looking for in regards to our day today.